Subscribe to my channel Medicine Guide. Diarrhea, gas, heartburn, nausea. What is the action of antidiarrheal? Antidiarrheals are a class of medications used to treat acute and chronic diarrhea. Antidiarrheals help to reduce the frequency and urgency of passing stools. However, they do not eliminate the cause of diarrhea, and hence diarrhea will occur as soon as you stop the antidiarrheal medications until the underlying cause, such as infection or inflammation, is treated properly. Diarrhea is a common problem and usually lasts for a couple of days, whether treatment is taken or not. However, antidiarrheals will help you feel better, especially if you have cramping pains. It can be caused by bacteria and parasites, viruses, medications such as antibiotics, lactose intolerance, inability to digest lactose, the main carbohydrate in dairy, food allergies, digestive disorders, irritable bowel syndrome, celiac disease, Crohn's disease. Antidiarrheals are administered through oral and intravenous routes. A few are also available as over-the-counter medicines without a prescription from your doctor. Do not take antidiarrheal agents without the prescription of a healthcare professional when diarrhea is accompanied by fever, severe illness or abdominal pain, or if there is blood or pus mucus in the stool. Antidiarrheals work in the following ways. Antidiarrheals work by decreasing the flow of fluids and electrolytes into the bowel and slowing down the movement of the bowel to decrease the number of bowel movements. This allows more fluids to be absorbed into your body, which helps in having less diarrhea and more formed and bulky stools. They help in balancing the way fluid moves through your intestines and thus reduce inflammation. They also slow the growth of bacteria that might cause diarrhea. How are antidiarrheals used? Diarrhea can lead to a serious loss of body water, that is dehydration, and minerals, electrolytes. Drink plenty of fluids to replace the nutrients you may have lost. In addition, stick to a bland diet during this time to reduce the irritation to your stomach, intestine. Antidiarrheals can be used in conditions such as acute or chronic diarrhea, gas, upset stomach, heartburn, indigestion, nausea, flatulence, traveler's diarrhea, which is an intestinal infection that occurs as a result of eating or drinking contaminated food or water. Irritable bowel syndrome, a chronic disorder that causes abdominal pain, bloating, and alternating diarrhea and constipation. Severe diarrhea associated with metastatic carcinoid tumors, a type of slow-growing cancer that can arise in several places throughout your body. AIDS-related diarrhea, chemotherapy-related diarrhea, short bowel syndrome, a malabsorption disorder caused by a lack of functional small intestine. Post-ileostomy, which is a surgical operation in which a damaged part is removed from the ileum and the cut and diverted to an artificial opening in the abdominal wall. Stomach ulcers caused by Helicobacter pylori. Disclaimer: Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert, and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only. Thank you for watching the video. Please subscribe to my channel Medicine Guide.